Well, we expect to begin vaccinating individuals here in Kentucky this coming Tuesday, and that is incredibly exciting. All across this country, we have been at war with this virus, and while we still have a long way to go, victory is in sight. So now what we have to do is we have to prioritize this vaccine for those that need it most. For us, per capita, our deaths have been a lot lower than most other states, but our long-term care community has been hit really hard. 66% of all of our deaths here in Kentucky due to COVID-19 have been in those facilities. So we will be one of the first, if not the first state, to activate the CVS Walgreens plan to vaccinate all members of our long-term care community, from the most acute nursing homes all the way down to assisted living. Our goal, starting on Tuesday, is to get that entire population vaccinated, hopefully by the 1st of March. If we're able to do that, meaning in the next 2.5 months, to vaccinate that entire group, it'll be a total game changer in Kentucky, and it will ensure that we don't lose people at the same rate moving forward that we have thus far. At the same time, we're vaccinating our frontline healthcare workers. I believe within the next 10 days, we are going to have vaccines to every acute hospital across Kentucky where they can prioritize their ER staff, those on the COVID wing, those that are working so hard to protect those around us. And by doing that, we can protect our healthcare capacity. So this is really exciting, but we will have to preach patience. Patience to all those Americans and Kentuckians that really want this vaccine. Just let us get to those first who are the most vulnerable to this virus. There will eventually be enough for everybody.
Now, once you get to the general population, Governor, if the flu shot is any indicator, getting all Kentuckians vaccinated is going to be a challenge, because I'm told an average of only 40% get the flu shot in Kentucky historically, according to the CDC. So how do you get that number up for COVID?
Well, I think it's hard to compare the flu shot with COVID because of what's been going on the last 9 months. The changes in our lives, how COVID has turned things upside down. And what we're seeing now is just about everybody has lost someone or knows someone that has lost someone. We see impacts on our lives in terms of school and work and leisure. We see the health impacts all around us. So I believe that there is significantly more appetite and willingness to take these vaccines. And I think the efficacy of the Pfizer and the Moderna vaccine changed everything. And when you look at a flu vaccine being 66% effective, well, that's one thing. Maybe you'd say, I can get by. But when you start talking about 95% effective, and we as a country are able to talk about truly defeating this virus, that changes things. And so what I'm seeing right now is a shift. And again, we're going to have to build confidence in the vaccine, no question. But I'm seeing a shift where I have less concern about building the confidence in the vaccine and more concern about everybody having patience. Patience about when it will reach you.